welcome, Dr. Who, to the Mental Margarita Show, Nevada Dental Sleep of Henderson, Nevada. We're so glad to have you with us. You're going to teach us all about sleep apnea and the things that you do for our community to make them healthier and live longer, fuller lives. How are
Well,
you today?
wonderful, and thank you so much for having me. Yes, I'm very, very passionate about this field that I am in because it affected myself and my family. And I just kind of want to start with the fact that there's over 1 billion people, the letter B, billion, in the world who are underdiagnosed, undertreated with sleep apnea, airway breathing disorders, and it's all connected to so many a myriad full of systemic issues and quality of life and health. So I'm really glad to be here today, and thank you for having me. Yeah, so sleep is supposed to be a third of our lives, right? We're, as adults, supposed to get 7.5 to 8 hours of good quality sleep, 7 nights a week. For children, it's even more hours of night per week. And when we have sleep breathing disorders or fragmented sleep, it causes so many issues, not just like your performance, your clarity, your job performance, your energy levels, your appetite. All of it's all interconnected. So it's very important that people may go to the doctor without knowing that a lot of the issues that they currently have are directly linked to the quality of sleep that they have. And if they treat the quality of sleep, they can actually wean off of the big pharmaceuticals, the medications, in which we all know has a lot of side effects and a lot of other issues, not just financial aspect, but also more hospitalization, more severe issues requiring from surgeries to you name it, right? So really focusing in on a third of our lives of having good quality sleep night to night is very, very essential and important. So one thing that we really want to kind of educate and tell the public about is there's a lot of issues that people need to know the truth, right? The full truth. When we think about big pharmaceuticals, it's already a given that they have so much money, so they lobby and they actually get even the government or whatnot to back them up. But again, with all the different side effects and with all the different medications that are out there, people don't realize that, for example, when my mother, who's passed away last year, she's been on 40 years of hypertension medication. And that did a toll on her kidneys. So when her kidneys failed, she had to have dialysis. And one day when she had dialysis, they took too much fluid out of her body. Her electrolytes went out balance. She had a heart attack and passed away. And so you can see all different cascade of things that actually stem from the traditional medical aspect, which is prescription after prescription after prescription, right? And on the other hand, too, there's like memory issues, brain fog, Alzheimer's, dementia, depression, mental health. Those are actually all very much connected to sleep as well. I lost my dad over 3 years ago to Alzheimer's dementia, but that also exacerbated concurrently with his congestive heart failure. But once again, both my dad and mom never had a primary care physician tell them until it was too late. It's kind of like that 1 billion, statistic that I just mentioned, until it was too late. Because either they've already advanced in Alzheimer's dementia, like my dad, and then later he had Cheyne-Stokes breathing, airway issues at night. He had congestive heart failure. Then he had hydrocephalus, and then they didn't do a really good job. They're supposed to put a shunt in his brain to the cerebral spinal fluid was building up, putting pressure in the brain and stuff. And so that ended up being a cascade of other events that led to his premature death. So anyway, it's very, very passionate for me to be in this because these are real serious issues that happen to my own family. I myself, I've been overweight most of my life, right? And so I didn't know what I didn't know. My family didn't know what we didn't know. We all snored at night and we thought it was funny. Sometimes we would gasp for air. I had acid reflux. I was almost nearly 400 pounds when I was at my worst condition doing cosmetic and implant dentistry. That's before I did any dental sleep medicine, right? And so dentistry can be a very stressful. I mean, you have to numb patients up. Nobody's really happy to see the dentist, especially if they have a filling or an extraction. So there's a lot of stress and mental, anxiety dealing with patients day to day with that. Then it was very easy to stress eat and not have that quality sleep. And then when you combine that together, plus the idea when we don't, spend our time looking at nutrition, we get fast food. And fast food, you're putting a lot of preservatives, a lot of, you can take a burger from a fast food, put it in the lawn for a couple of months, and it will never grow mold. It tells you how many chemicals, right, are in that. And that can be very, very scary going through our body trying to process that. You can imagine the allergic response, the autoimmune response, all these other issues that can happen. And right now, we really see an incidence of morbid obesity increasing in the US as well. You see kids, they got to go get their, Happy Meal or whatnot. And that's a lot too, again, with the chemicals and that addiction and the lack of awareness and knowledge. So it all goes together. But it's very, very important that we look at sleep quality.
Dr. Who grew up in rural Alaska and attended the University of Michigan Ann Arbor through the highly competitive preferred admissions program. Here he attained his combined Bachelor of Science and Doctor of Dental Surgery degrees at age 24. He then went on to get multiple fellowships and masterships in implant and cosmetic dentistry. As he learned about how his own airway and sleep apnea issues were tied to his overall health and quality of life, Dr. Who became aware that sleep breathing disorders are far too often overlooked, underdiagnosed, and undertreated. After losing over 100 pounds himself as he addressed his sleep apnea issues, he became passionate about airway-centric dentistry and airway treatment. He became one of only a handful of triple board certified sleep dentists in the world. He continued with his passion for airway treatment and spreading awareness.
Now, for most of the process, when people start looking into their sleep and they get treatment, they look at the CPAP machine. And let me just start with a very important history there about CPAP machines, okay? So CPAP was invented by Dr. Sullivan in Australia. And basically what he did was he took a vacuum cleaner and he reversed it. Rather than sucking in air, it blows air out. Now, there's a problem right away with that because if you think about the way we breathe, right? I have a good friend, his name is Patrick McGowan in Ireland, and he lectures about Buteyko breathing. There's a rhythm, there's, when we inhale, exhale, there's something natural and kind of human element that a simple machine that continuously blows air doesn't do that. It interferes with our rhythmic patterns and things like that we normally do. And with that said, that's the first thing, because sometimes people, when they use a CPAP for long term, your brain says, well, gosh, if I have a machine pushing and forcing air down, I may start to just stop breathing myself. That's called central sleep apnea. Central sleep apnea is neurological. Your brain is shutting down. You're not breathing. There's no effort to breathe. And so, an apnea is an apnea. So if you stop breathing, you'll have oxygen desaturation levels, you'll have sympathetic overload, and I'll kind of get into that a little bit later. But the most important thing about the CPAP then is first you have that's not naturally breathing for you. Now they've come up with BiPAP and other VPAP and all these other PAPs to do that. But again, there's so many issues that it's not out in the public. So first I'll start with the recalls. A few years ago, Philips had to recall most of their CPAP machines because their tubing blew carcinogens down people's airways night and night. So that is not healthy. That's really bad. You have cancer-causing agents going down. But this year, ResMed recalled most of their CPAP machines because they interfere with any pacemakers, any heart rate, rhythm things. So that is a big no-no as well. And also this year at Columbia University, they had pulmonologists do a study about angiopoietin 2. What happens is anybody who used the CPAP machine, if they use that pressure above 7, when that air hits the lungs, the endothelial cells in the lungs will release a factor called angiopoietin 2. And any cardiologist you talk to, go to Nevada Heart and Vascular or any cardiologist, they'll tell you the angiopoietin 2 is a higher risk for heart attacks and strokes. You're trying to use the machine to lower the risk, right, for heart attack and strokes in the middle of the night, and yet you're using this machine when most people do use pressures at 7 or greater. With that angiopoietin 2, it's the opposite, but they're not telling the patients these issues and these risk factors. Moreover, when you talk about the CPAP machine, there's a whole slew of other things that people kind of just really close one eye, open the other, and that's no good. I'm talking about a lot of the doctors and the people really who should be very, very serious about this. And that's one is about the cleaning of these CPAP machines. There are a lot of, tubes and hoses and things like that that are supposed to air dry. You're supposed to clean them thoroughly. because if bacteria builds up in them, people can end up with Legionnaire's disease or pneumonia or a whole slew of infections, right? So, as a dentist, I can appreciate that everyone doesn't floss every day. They may floss once a week or they never floss. So bacteria can build up, right? And, the flossing to me is probably easier than cleaning a CPAP machine appropriately. So if you don't clean the CPAP machine appropriately, then that bacteria, the biogum, can build up. And that can be, a very, very big risk factor for infection. Other things too, if the air goes in the wrong way, there's a thing called aerophagia. It could bruise your chest. It could hurt your eyes. There's a whole slew of side effects that people aren't really talking about, right? So once again, when you look at all the studies for that machine, right? Every sleep center you go to, the first thing they're going to do is they're going to push that machine on you, and they're going to bill your insurance. They're going to, try to fit you with a mask. And if that doesn't work, they'll change a mask. They'll do this because, again, when you look at CPAP, it's an over $5 billion annual industry. So thinking about the B word again, it's a lot of money. When they have money like that, there's a lot to be made, and there's a lot of lobbying. There's a lot of things that they're doing to push for that, but that's not an effective treatment. They've done studies and they show. Remember what I just said a few minutes ago. As an adult, you're supposed to sleep 7 nights a week at 7.5 to 8 hours. In the U.S., all studies, all the cohorts and the big meta-analysis show that when patients use CPAP, on average, they use it 4 to 5 nights a week at about 4 to 5 hours a night. So if I did a dental crown on you, Rebecca, and I said, please just use the crown 4 days a week, you're like, what kind of bad dentist are you? I want to use my crown anytime I want to eat or chew. Yeah, and yet in that scenario, if we did a really bad crown on you, what's the worst that can happen? Well, you may need a root canal, you may need extraction, you may need to have, some kind of a bridge or an implant. But with sleep apnea, if you're not using the machine, it's zero treatment. You can die from a heart attack in the middle of the night. It's very serious. So it really, really bothers me that, Vegas is growing to be about 3 million people very soon. We're, gaining a lot of people in the valley. And I cannot believe, sort of this underlying, elephant in the room that's unspoken is, if by all means, if you're very compliant with the CPAP, if you clean it very well, if you use it on pressures that doesn't cause angiopoietin 2, absolutely go for it. I love that. But if you don't have that, I think it's very, very important to talk about the other alternatives, right? So with that said, in our office, we're really about knowing the patient's health history, their medical record, going over their sleep exam and going over all their different symptomatic things that they report to us. And then again, what's so cool is I never thought as a dentist I can actually change quality of life. I thought you'll make some smiles, you'll make some good feelings, some cosmetic dentistry or implants, but I'm talking about even relationships, right? There's things that's what we call sleep divorce, where you can't even sleep in the same with your spouse or partner because you wake that other person up because you choke, you gasp for air, you have acid reflux. And when we start to see these appliances and things that we make that difference, it's incredible. I mean, sometimes it's actually very emotional. I also see veterans here as well. A lot of veterans, the one most touching story was he was a kind of a double amputee, and he fought in the Vietnam War. And, so the VA system sometimes it's a little bit broken. They've been there on wait lists and things like that. So I'm doing everything I can to help get these, soldiers, these veterans that, for our freedom, you know what I mean, to get them healthier. And it was incredible. We're able to get them an appliance. They're sleeping better. They're sometimes welcome back into the bedroom, things like that. You know what I mean? That I think it's just, it's awesome. The divorce rate is so high. I think Nevada has one of the highest divorce rates and a lot of other issues with that. So, and you talk about children, that's even another emotional aspect. Oftentimes children are misdiagnosed with ADHD and ODD. Now, when we were little, when I was a kid, we didn't even really hear about ADHD or LD, right? And so now the issue is people don't know what they don't know, including teachers. So they see a child at school, for example, who's tired all the time, or they're very, very overreactive, or they're hyper. Well, they are not sleeping well. Let's say they have swollen tonsils, or they have adenoids that are hypertrophied, right? And they need a tonsil adenectomy, but they also a tonsillar adenectomy. Excuse me. But they also need orthotropics and growth guidance and myofunctional therapy, right? So you take that bubble, that realm of treatment, and you versus the classical one that we see here. What is that? It's more drugs. It's Ritalin, it's Adderall. Technically, when we were kids, those are speed. If you took speed, you were called a druggie when we were a kid, right? So if you're giving Adderall and speed to kids to get them, to go over past a certain hump, if you will, then they calm down, that's really not good. First of all, because it is pharmaceutical, it comes with its side effects, but we're not doing what's the root cause of the situation. If I choked your neck 200 times per night, every night, do you think you can go to school and function well and behave well? I mean, you'll be irritable, or you'll be tired, or you'll fall asleep, or your brain fog will slow you down. And a teacher may say, hey, look, you know what? You have this whole problem of behavior, and what we're going to do, we're going to refer you to some counselor and end up being some kind of prescription. And albeit sometimes it will calm people down, but we need to check, we need to have a sleep study done, we need to have a polysomnogram, we need to look and see what's going on at night, because if we don't have proper REM, and I'm going to go into REM a little bit as well, and N3 slow wave delta sleep, then no wonder why when we go to school, those things from sports, our ability to be our fullest potential, our ability to thrive isn't there, right? So REM is very important. Every mammal, including tigers, elephants, our doggies, all need to have REM sleep. REM stands for rapid eye movement sleep. For adults, human adults, we need 25% of our sleep architecture to be in REM. Now, REM is very tricky. It's almost like a irony paradox type of thing, okay? We need REM because our brain is recharging during REM. If we recharge our cell phones, we need to recharge our brain. Our brain is generally over 200% capacity during REM sleep than we are when we are awake. But during REM, we're dreaming, and the biggest important aspect of REM that we need to talk about is that the entire body is paralyzed during REM. Every muscle is atonic, your brain is recharging, so your tongue, everything becomes flaccid. Well, if you're sleeping on your back, guess what happens? Gravity, the Earth's gravity, become our biggest enemy. They'll take that tongue, they'll take that jaw, and they'll take all of that, and they'll just pull it down. Well, if it pulls it down, guess what's on the bottom? It's your posterior pharyngeal muscles and the walls, the vertebrae behind that. And when that collapses, oxygen is never, ever going to get to the lungs. So if oxygen doesn't get to the lungs, you're going to start bruxing your teeth. Your body, from a primitive standpoint, is going to say, I need to have a patent airway, because if I don't, I'm going to die. Now, in the hospital, every hospital in the United States, if your oxygen goes below 90%, it is a fact. The nurse is supposed to push a crash cart to you. That's how serious it is. When we get some of these sleep study test results, I don't care if it's children or adults, it is so alarming. They'll go like to 70s or 60s. If you're in the 60s, sometimes a fresh dead cadaver would have more oxygen in their bodies than, and you're thinking, how are you able to survive night to night? Well, if you look at the news, a lot of people, even celebrities, you look at Reggie White, you look at Carrie Fisher, who played Princess Leia, Ray Liotta, who played Scarface, their official cause of death is sleep apnea. It's sleep-induced, although they may have a heart attack or a stroke or something like that related, but it's because the oxygen went so low. During sleep, we're supposed to be in parasympathetic tone. Parasympathetic is a calm, it's re-energizing, it's all of that, right? So when the oxygen goes low and the brain says, you know what, I can no longer afford to be in parasympathetic, I'm going to shift to sympathetic. That means fight or flight. Now, if a guy's chasing you with a gun, if you're running from a bear, fight or flight is good. Yes, you need that adrenaline, you need the cortisol, you need to get out of there to survive. But it's not good at night. We're supposed to be calm, resting and sleeping and rejuvenating, right? And during N3 slow wave delta, our hormones, our immune system, all of that. In our hormones, it's important because the two ones, the leptin hormone and the ghrelin hormones, those are tied to actually weight loss, appetite, craving, stress eating, the sensation of feeling full or not feeling full. Those are in N3 slow wave delta sleep. So those are very, very important for us to realize that if our sleep architecture is completely broken apart or fragmented due to these oxygen desaturations levels, these hypoxemia, we're going to end up sometimes with acid reflux, or sometimes we wake up halfway. We don't realize we're waking up, but we're waking up kind of halfway, if you will, and that can do a toll night after night after night. So it's no wonder how people end up with a heart attack, or some people end up with a stroke, or they end up, not knowing what happened and their teeth are fractured or teeth are, because that's sleep bruxism. And again, sleep bruxism is connected to the root cause of airway and oxygen deprivation.
Now, when a patient comes to you, you're using some cutting edge technology in your office to detect and make all the right adjustments. Will you tell us a little bit about that technology that you use that helps you as people choose which appliance they're going to use? How that the treatment then helps solve the problem?
Thank you for asking that question. It's very important because, well, first, I have this really strong belief that you should measure things. You should not, quote unquote, be cheap and not have the proper equipment to measure, because measure is scientific. Otherwise, it's just an expert opinion. So we have, from our equipment, I'm going to explain, and not all dental sleep medicine centers have this, right? Sometimes you kind of got to really be discerning when you look for a doctor or provider, because they could have just gone to a weekend course and they use little cheap gauges that are like $2.50, and they try to minimize this, and that's not what we want. This is a very serious medical condition, right? So we start off with a CT scan. It's cone beam. It's got DICOM files, it's 3D analysis, but also the cone beam that we have is so special. We kind of have the mothership, if you will, and they have this green light, green wave technology. So the radiation pretty much is almost like negligible, because if you're out in the sun for a few minutes, you get more radiation from that. But the information you get will blow your mind. You get to view the entire upper airway, all the hard tissue, soft tissue, so includes the skeletal, the skull, all of that, the bones, the cranial bones, as well as all the different like adenoids, the turbinates. And what's important is we need to realize that, in the US, we kind of compartmentalize everything. If you have a heart issue, go to cardiologist. If you have a foot issue, go to podiatrist. And technically we're one body, we're connected, right? So it's very important though that when we see a sleep apnea dentist, that they're able to connect all of that. And so with the CT scan, we're able to ascertain if you need to see your nose throat for turbinate reduction or septoplasty or nasal concave, things that we need to do to work with otolaryngologists, ENTs, right? Also, if there's other nutritionist aspect, if you're overweight and all these things, we have to review all of that. I always tell patients I'm not an expert nutritionist, but I myself have lost over 160 pounds since my heaviest. And I go to the gym, and I have mental health. I always talk about 4 legs to a table, right? One leg is sleep, one leg's nutrition, one leg is your exercise, and one leg is your mental health. And people say, what do you mean by mental health? Well, if you're anxious all the time, you have depression, you have insomnia, I'm sorry, you're not going to have good quality sleep, and it'll affect all the exercise and nutrition as well. So with that said, we have our CT scans, we have axial, we have 3D views, and we actually share with the patient all of that so they can see that. However, CT scan, like any x-ray, is one moment in time. It's a snapshot. So then what we do is we do a clinical exam where we find out all the different, presentation. How is your malampati? How is your airway, your tongue size? Is your scallop border tongue thrust? Your teeth? Is your crowding? Is your lack of interarch space? All those things, we collect that. Then, because breathing earlier, I said it's kind of a dynamic, it's inhalation, exhalation, there's rhythm, there's all that. We use acoustic reflection, and we actually look using a pharyngometer rhinometer at how well your nasal function, nasal breathing is. And we also look at your oral pharyngeal airway, and then you'll be able to see the equipment readings. And then we do actual certain maneuvers to actually simulate what an apnea would look like while you're awake. Because most people will say, hey, apnea is done when you're asleep, but we'll be able to do that while you're awake. And then we actually use digital scanning, because we want to be as precise about that bite and that position that we want to hold the jaw in. Because again, remember, during REM sleep, the gravity can become an enemy. And as your muscles are atonic or flaccid, it can block and collapse the airway. So we want to make an oral appliance to keep that airway patent throughout the night. And that's the magic right there. So through that process, people really appreciate how kind of AI technology has gone, forward, because you're looking at 99.999 some, percent accurate when we use all the digital format to scan the teeth. In the olden days, when they did any type of appliances or any type of dentures or partials, it's always with the gooey stuff, the impression. And now the gooey stuff, you can imagine Vegas in the summertime, it could be 120 degrees outside. And if that's going to go to the lab, that's going to make the appliance. If it goes in a FedEx truck and it goes somewhere where it's like 60 degrees, that thing can distort. That thing can kind of warp a little bit, and that's no good. We want things to fit well, to feel comfortable, and have accuracy in that. Untreated sleep apnea from kids to adult can at most decrease lifespan 22 to 23 years. That's a lot of years. I can't imagine, especially the golden ages when grandparents want to be at their grandkids' graduation or marriage, and they died because they choked to death, or they had a heart attack. It would be one of those things that I think is very important to address.
And breathing well. So we want people to live well, breathe well, sleep well, and come and see Dr. Who Nevada Dental Sleep. We'll make sure that everyone knows how to reach you.
Oh, thank you.
Your website. Your website is full of lots of resources, lots of information. And then they just need to give you a call and come and see you and start living better.
Absolutely.
Dr. Who founded Nevada Dental Sleep, excited to bring to the Henderson and Las Vegas Valley area cutting-edge technology for sleep medicine and airway treatment options for the pediatric population to geriatrics. He is also passionate about moving the needle for airway and sleep apnea awareness globally, and hopefully to help improve lives through long-term effective therapies and treatment. There are so many comorbidities, from cardiovascular issues to Alzheimer's and dementia, and even ADHD and ODD in children, that Dr. Who can make a difference in health improvement and treatment. During his downtime, Dr. Who loves hiking and mountain climbing. He loves going to the gym on a routine basis and loves to spread healthy lifestyle awareness, nutrition, and exercise goals. Attention business owners, get your messages to Pahrump and Nye County by advertising with KNYE 95.1 FM, the big voice of Pahrump and Nye County. Call 775-537-6100. That's 775-537-6100. Give in to your mad cravings with a healthy bowl from Teriyaki Madness. Real food made to order, prepared with fresh, high-quality ingredients that make you feel like $1,000,000. Satisfy your cravings at these Southern Nevada locations in Pahrump and Henderson, where friendly staff is awaiting your visit. Experience the madness. Teriyaki Madness.